Having sex too often or too infrequently can feel different from others, not quite normal. So what exactly does normal mean? Some sex psychologists believe that once a week is the optimal frequency for relationship quality and happiness. Beyond once a week, relationship quality and happiness don't improve. So this is the most cost minus effective frequency. A study published by Harvard University medical team found that for adult men, ejaculating 21 times a month significantly reduces the risk of prostate cancer and is therefore optimal for health. But clearly, these theoretical and observational data can only provide a distant reference. Sex is a deeply personal matter. What constitutes normal sex in love? In Sternberg's triangular theory of love, the best love is composed of intimacy, commitment, and passion. Passion is a crucial component of sex. In other words, in the most widely accepted theory of love, passionate sex is often indispensable. Whether in everyday experience, theory, or statistics, the longer a partner is together, the more likely sexual passion, manifested as a decrease in sexual frequency, is two-way near minus default outcome. However, the factors that truly influence sexual passion are very specific and vary greatly from person to person. For example, consider the culture each person has been raised in. In a cross-minus cultural study on love, researchers found that American couples are more passionate than Chinese couples. Although we're all Chinese, this result suggests that if you grew up surrounded by a more westernized culture, likely adoring American TV series, you might be more demanding in a relationship. Another example is the level of sexual openness. The more sexually open someone is, the more likely they are to find sexual release, such as watching porn and masturbating, and their sex lives are likely to be more passionate and romantic. In contrast, those with a low level of sexual openness may appear more abstinent and may not be fully engaged in their sex lives. Currently, stress is crucial. The fast pace of life can easily overwhelm a young person's libido with a phone call from their boss. Furthermore, the pressures of household chores and childcare and dampen passion to a breaking point. On a cognitive level, there's a little minus known fact worth noting. The more a person agrees with the idea that passion fades, the faster their partner's passion fades. There are so many reasons, and you don't know which one of these factors, or a combination of factors, you're currently experiencing. This is why a 22 survey yielded a surprising result. Researchers couldn't find a specific pattern in sexual frequency among the respondents. In the survey, researchers identified 14 factors that could be associated with sexual frequency, including love for their partner, the degree of marital status with their partner, their own personality traits, and whether their partner and they were sexually attractive. However, the 720 sexually active participants didn't provide a consistent answer as to what influenced their sexual frequency. This situation often occurs in psychological surveys when participants come from different countries and situations, and the questions we ask are highly personalized. There's no one size fits all in. So stop focusing on your sexual frequency and don't worry about whether your sexual activity is normal. The concept of sexual self-esteem originated decades ago when psychologists discovered that sexually active boys had higher self-esteem than sexually active girls, and that sexually active girls had lower self-esteem than their non-sexual peers. This led them to believe that there must be a mediating factor between sex and self-esteem, and that this factor is sexual self-esteem. Sexual self-esteem encompasses the following aspects. Skills and experience. Are you satisfied with your sexual skills and experience? Or do you feel that having some experience is a negative factor? Attractiveness. Do you consider yourself sexually attractive? Are you satisfied with your body? Or do you consider yourself sexually resilient? Control. Do you have control over your sexuality? Can you control your sexual fantasies and behaviors? Or do you often feel out of control? Moral criticism. Do you rarely criticize your own sexual behavior, or do you frequently criticize your own sexual behavior, fantasies, and desires? Adaptability. When you enter a new relationship, do you always adapt quickly to your partner's sexual life? Or do you find it difficult to accept new sexual attitudes or partners? If you answer yes to the first question in each of these 5 areas, you have strong sexual self-esteem. Conversely, your sexual self-esteem may be low or fluctuate frequently. Sexual self-esteem can easily fluctuate. For example, someone dissatisfied with their body may have recently gained weight. Someone may have an unconventional sexual experience with their partner, leading to self-criticism, or someone may simply experience a loss of self-esteem due to a loss of job or setbacks in life, leading to a decline in sexual self-esteem. Low and fluctuating sexual self-esteem can reduce our sexual satisfaction and lead to suspicions of insomnia. There are many ways to improve sexual self-esteem. For example, according to the definition of sexual self-esteem, we can enhance our sexual self-esteem by improving our skills and getting better shit. But these are superficial efforts. Just like improving self-esteem itself, external, objective factors can help, but what we truly need is internal, cognitive, and conceptual improvement. What truly helps improve sexual self-esteem is cultivating a positive mindset about sex. Sex positivity, as the name suggests, considers sex a positive thing as long as it's practiced safely, of course. In various cultures, sex was once considered taboo, and today it's not something that should be discussed openly. Sex positivity, on the other hand, encourages people to talk openly about sex and pursue sexual pleasure and experiences openly. Sexual harassment and assault are not considered sex-positive. Sex positivity encourages us to learn more about sex, not only about how to protect ourselves and have sex safely, but also about how to experience sex as individuals who deserve it and maintain an open attitude towards sex. Based on the definition of sexual self-esteem, a partner with a sex-positive outlook will be willing to expand their sexual skills to satisfy both themselves and their partner, develop a deeper understanding of their own and their partner's sexual attractiveness beyond just appearance, develop greater control over their own sexual desires and preferences as their partner confronts these issues head-on and can focus on them effectively, provide less moral judgment about their sexual desires, preferences, and fantasies as their partner understands them from a personal perspective, develop greater adaptability to different sexualities as their partner is more open-minded. Sex positivity cannot be used as an excuse for infidelity or legal violations. Sex positivity not only benefits sexual self-esteem, but also overall sexual satisfaction and overall mental health. In short, sex positivity can make us more open about sex, which is also beneficial for sexual communication within a couple. When we encounter the initial problem, a decline in passion with our partner, a sex-positive outlook can make us more willing to try new things and less shy about discussing sex openly with our partner.